is moderate to high. Snakebite treatment is our focus against the background of unverified claims of local treatment on social media. The conversation will begin with Dr. Nander Dulfa, former Chief Medical Director, University of Abuja Teaching Hospital, a man with a vast knowledge of snakebite treatment, having presided over the country's ECITAP anti-snake venom project. Stay with us. Is snake bite something that is considered an emergency or not? Let's start.
Yeah, snake bite is definitely a public health emergency, both in Nigeria and in many other African countries. And the eastern area, India, Pakistan, Thailand, all those ones suffer the same consequence as a result of snake bite. So it's a very serious emergency in this country.
Okay. Let's look at the treatment regimen now for snake bites. What form should it take?
Snake bites, we have the major form of snake bite treatment is antivenom, relevant antivenom to be given parenterally. Antivenom is developed as the name entails in some animal which reacts to injection of venoms, and the reaction is produced purified and given to human being. Nigeria is very lucky to have embarked on that same project almost about 30 years ago by Professor Ramson Kuti. And we have developed through that same project initiated by him 2 active antivenom, which cures immediately when it is given when somebody is envenomed. So we have it. The 2 types are ECITAP G, which is mainly against carpet viper, which is paramole or gobedenisa in Hausa, and Itachika, is it Igbo? It's the same, virtually the same thing, gobedenisa in the Igbo language. So over, I can say, 90% of cases of snake bite is due to the carpet viper envenomation. We have others like black, we have cobra, we have black, this in cobra, and then the black viper, yeah. No, viper is part of the carpet viper and all those this thing. So the puff adder, puff adder, and so those are 3 major snake bites, snakes of importance. Further down south, we have other rare cases, like some of the rare cases, but these are the major treatment causes of cases of envenomation.
We've established the fact that snake bite is a public health emergency. And so what's your take on, claims of cure that have, been circulating, in the social media? I can mention a particular one that says that one bitten by a snake could get the bark of a cashew tree and, process and take, and that, would take care of the bite. What's your take on that?
I can say that's a very dangerous uh, pronouncement by any, whether medical or non-medical. I got three write-ups of that sort in my own platform. So some people decided to send it to me because they wanted to get my own reaction. And indeed, I told them that in any case of snakebite, the most dangerous thing is to cause delay. So for anybody to go and waste his time in a native doctor or any other places, instead of seeking for medical immediate anti-venom treatment, is dangerous, because even if they present themselves for treatment in the right way, the delay might have can cause deformity, can cause death, and can cause many other things, consequences for the delay. So we should try as much as possible to cancel those type of information. It's a very dangerous. Let nobody take it serious. We have other useless information like Blackstone. Before then, that if you are bitten by a snake, you apply what they call Blackstone at the site, and it draws the venom. That is wrong. It doesn't work. And people, the natives are trying to use Gedeli, some natives have, to apply on the site of bite. Same. And sometimes they apply electric shock. I don't know what that one tells. All in the name of treatment of snake bite. So they don't work at all. As much as possible, we should try and get ourselves used to the right treatment. That is getting any hospital that has antivenom to be able to treat it correctly. There are some successes in bracket that the native doctors claim that they succeed in treating somebody within a day or two and discharging, while a lot of money is being charged in the conventional hospital for antivenom. Well, in some cases of snake bites, we may have what we call dry bite. You will see site of bite punctured, but there is no injection of venom. Commonly, and when those cases are treated by native doctor, they will just hail him that within 2 or 3 days the patient was well. But if there is any real venomation, I have many cases that the patient ended up in wasting his time in the
Seeking
seeking
unconventional.
unconventional medication. And by the time they come to the hospital, maybe they have already have gangrene, dead legs or dead limb, which would only work if you, even if you give the antivenom and cure, you cannot generate the limb. So you remove it. And when they get back home, they will ask them, how do you lose your limb? They say in the hospital. So it even frightens them more. But on coming to the hospital, they won't tell them that the limb was dead before coming to the hospital. So there was a case. I attended a meeting in Sudan, Dakar, Senegal, where they attempted bringing the native traditional healers and the conventional treatment using the orthodox method. And it's a very interesting field, so that they should know each other. The native doctor have taken it as a means of livelihood. So to remove it from them that go to another place, you need to have a lot of health education within the community, so that people themselves will know what they will benefit if they seek for conventional treatment. And if the government could make the cost lower, because sometimes it's the cost that make them to seek for something cheaper. Yeah.
Okay, so if you don't amputate, what could happen?
Yes, some of the limbs, if you don't amputate, at least the dead part of the body would affect your, to be hanging with a dead limb, lower leg, it will affect your health and it could lead to death. So you do it to save life.
Curious about how government policies on healthcare are faring? Do you enjoy learning about wellness concept and the many options available? Then watch Health Options on the NTA.
Mr. President has led by example. Take the COVID-19 vaccine.
Somebody can say, hey, I woke up this morning, I felt some tingling in my hand, some weakness, my face was, I couldn't speak well. That's a warning stroke, and it shouldn't be ignored.
The carrots contains carotene. Tomatoes is a colored plant. It has carotene. Pepper has carotene.
50% of our diet should be green vegetables and fruits.
Join leading experts on both orthodox and alternative medicine for all the enlightenment you need for a healthier you.
Thanks for joining us on the program. I am Rabi Abdullah.
Okay. We had earlier on established snakebite as a public health emergency. How long or how fast does a venom kill a victim? How long does it take? So that we know, where to draw the line, that to really establish the fact that delay in treatment is dangerous.
Yeah, when snakes bites, it sort of inoculates the venom into our body. If it bites through a vein, it means the venom is going to be circulated immediately. If it bites somebody who has exercised or he runs, get frightened and runs, it means the venom is going to be taken from the site of bite immediately. But within 24 hours of presentation, the prognosis, the outcome of treatment, right treatment is very good. But if there is any delay, apart from this, the other factors that makes it circulate quite easily. But if you cause any delay, there will be other consequences like swelling of the muscles, the time for recovery of the muscles, tissue, would be delayed. And hence, we may have tissue death, which may result into some deformation. And when sometimes it has to need amputation. But fortunately, part of the time I was working in this anti-snake program, we had many cases of amputation from fingers to hands to, But now, because of the early response for medical treatment, we have, it's much improved. The recovery and the disability of the legs is much improved. Yeah.
You had earlier, enumerated the species of snakes that are readily found around the southern part of the country and even the northern part. Do we have anyone amongst them that kills instantly, immediately it bites its victim?
Yeah, we do have, but they are very rare. They are fairly rare in this country. We have some of the, like Niger, the collies, or some other specimen that affect the neurons. So it stops you from breathing. Yeah, some cobras affects the breathing. It stops transmission of stripe muscles. So it affects. I have one case that I got. Somebody was beaten in bed in zone 2.
Abuja?
In Abuja. He had difficulties in breathing. They were ready. The sister was a doctor. Is a doctor. They were trying to give him tracheostomy, artificial respiration. When he contacted Professor Nasidi, and Nasidi contacted me because I had the antivenom by then, the Ekita Plus. So I sent it to them. The person they were preparing to take him for an emergency operation. Once that one was given, he was discharged that same day. Yeah, because he neutralized the venom. Yeah, yeah.
We still have them available.
Yeah, we do. And presently, the Nigerian government is trying to assist to make sure that the antivenom are manufactured here in Nigeria, because the people that will collaborate with them are quite ready to transfer the technology and then collaborate with us. So we are still on that one at a higher level.
Curious about how government policies on healthcare are faring? Do you enjoy learning about wellness concept and the many options available? Then watch Health Options on the NTA.
Mr. President has led by example. Take the COVID-19 vaccine.
Somebody can say, hey, I woke up this morning, I felt some tingling in my hand, some weakness. My face I couldn't speak well. That's a warning stroke, and it shouldn't be ignored.
The carrots contains carotene. Tomatoes is a colored plant. It has carotene. Pepper has carotene.
50% of our diet should be green vegetables and fruits.
Join leading experts on both orthodox and alternative medicine for all the enlightenment you need for a healthier you.
Thanks for joining us on the program. I am Rabi Abdullah.
So maybe you could just sound some words of advice to Nigerians in view of the times we're in.
Apart from the exposure of contact of farmers, herders, with the increase in farming period, floods is another way of causing increase in human snake contact, because their holes are filled up. They rally for higher ground as well as normal people. So sometimes they say there's an outbreak of snakebite. No, there's no any outbreak of snakebite. Only that the snakes are clamoring for higher ground or dry land, wildlife as well as people. So this is a season that we have many cases of snakebite. And thank God we still have antivenom, and the federal government is trying to get more of the antivenom for use in our hospitals and other health centers.
Now, what could make someone set out on a journey and not get to his or her destination? Now, imagine a victim who cannot reach out to these responders, who doesn't even have the phone to reach out. Hello, thank you very much for joining us on platform. I'm Ruth Agwe.
And a girl, especially if the girl is a minor, she's not yet 18 years, if she gets pregnant, realize that such girl is sent out of school and the boy is left in school.
Just park to pick the call.
So how much sensitization is the FRS?
I don't agree. A lot of people are just deaf.
But is there any advice you could share on how environments could be protected against snakes? Do you have anything to share with Nigerians in that regard? How to keep snakes at bay? Ordinarily, what attracts snakes to one's environment?
Snakes are attracted mainly by rodents, cockroaches, and bushy environment. So we should try as much as possible to clear our bushes, to clear the environment. And a place like Abuja was a virgin land. So it's not, as I mentioned earlier, somebody was beaten in bed. So they do also follow septic tank, the drainage from the sewage, they do follow it. So we should try as much as possible to try and look and try to close the windows when you are going out, not leaving it unnecessarily. We have many cases that they do creep through some plants near the house into the house. Yes, through the windows. Even the doors, when you leave the outside doors unnecessarily open, they can creep into your room and bite you.
Thank you so much, Doctor. Yeah.
Curious about how government policies on healthcare are faring? Do you enjoy learning about wellness concept and the many options available? Then watch Health Options on the NTA.
Mr. President has led by example. Take the COVID-19 vaccine.
Somebody can say, hey, I woke up this morning, I felt some tingling in my hand, some weakness, my face was, I couldn't speak well. That's a warning stroke, and it shouldn't be ignored.
The carrots contains carotene. Tomatoes is a colored plant. It has carotene. Pepper has carotene.
50% of our diet should be green vegetables and fruits.
Join leading experts on both orthodox and alternative medicine for all the enlightenment you need for a healthier you.
Thanks for joining us on the program. I am Rabi Abdullah.
Now, what could make someone set out on a journey and not get to his or her destination?
Extremely important.
Imagine a victim who cannot reach out to these responders, who doesn't even have the phone to reach out. Hello, thank you very much for joining us on platform. I'm Ruth Aguen.
And the girl, especially if the girl is a minor, she's not yet 18 years, if she gets pregnant, realize that such girl is sent out of school and the boy is left in school.
Just park to pick the call.
So how much sensitization is the FRS?
I don't agree. A lot of people are just deaf.
That does it on Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I am Rabi Abdullah. Thanks for watching. See you next time.
My name is Biko. And I'm Mana. And together we are Biko's Mana.
What is up, everyone? My name is Ricky Smith, and I am the writer and producer of the Sesame Street Friends